which we know it is UAP, but patient unstable, this is RN. Even ambulation, which is UAP, but if the patient is unstable, this is RN. Okay, so let's look at this. For the RN, patient has to be unstable to do UAP job. What is a UAP job? Remember, guys, UAP job is non-invasive. Like UAP should not go behind the skin. Should not go behind the skin. So there are some exclusions here. If they ask you, will UAP, can UAP do blood glucose check? Can UAP do blood sugar check? Like finger stick? Yes. Why yes? Good job, Michaela. Why yes? It is invasive, but this is routine care. The patient themselves, can they do the accurate check to themselves? So UAP can do that. But if the questions say, can the UAP monitor glucose level? Can UAP monitor glucose? It is no, Zach. So Zach said no because they are not licensed to monitor. They can just check the blood glucose. Can UAP check vitals? Yes or no? Yes, exactly. Good job. But can UAP analyze and monitor vitals? No, they cannot analyze and monitor. They can just check routine vitals. Like in the morning, they check the vitals for the patient. This is routine, yes. But to monitor vitals, this is the VN. Okay, so UAP can do activity of daily living like bathing, hygiene, linen change, ambulation, routine vitals. They can collect samples, any sample, like stool sample, urine sample, sputum sample. Yes. Can they change the patient position? Yes, they can change the patient position. Yes. If the patient on traction, can UAP change position? If the patient on traction, it is kind of tricky. If they have not said any complication of the traction, if it is just positioning and interaction, it is yes. As long as they will not change the angles or the weights or anything, they might change the patient position. So be careful on if there is traction, because sometimes they throw you words. If it is regular prepositioning, yes. But if they adjust angles or change weights or these things is a no. Okay? So this is UAP. UAP also, can they do routine endotracheal suction? Yes or no? Routine suction. If it is routine suction, guys, routine suction, it's a yes. Routine suction is a yes. This is a thing for HISI. Routine suction is a yes. Yes. What about catheter, like condom cath? Can they apply condom cath? Urine catheterization, yes or no? Urine catheterization, condom catheterization. Condom cath, is it invasive or non-invasive? Non-invasive. Condom cath is a yes. It's just a condom cath. They will just insert it. If there is anything, guys, here in the group me, let me know if it is something for me, because you keep sending things and I'm not sure this is for me or no. Okay. So delegation, back to the delegation here, we're talking about the UAP. Okay. What about if the UAP saw dressing? Dressing is a this is a sterile process. They don't do sterile process, right? So if there is a spoiled dressing, UAP can report spoiled dressing. The dressing is spoiled, VN needs to change it. But they can report spoiled dressing. Collect sample. Can they collect sputum sample? Yes or no? On the chat, yes or no? Sputum sample. Guys, wake up. I know I'll try to make it short, okay? Yes. Okay, urine sample, yes or no? Good job, yes. Stool sample, yes or no? Okay. Can UAP insert enema? Okay. It is invasive, right? But listen, there are two types of enemas. There is an enema, they can just go buy it over the counter. It's a prepared enema, and the patient, they can just squeeze it to themselves, right? Squeeze it to themselves. The patient can do that, right? So if it is a prepared enema, UAP can do it. But if it says soap suds enema need to be prepared, you mix certain chemicals together, this is the VN. Deal? Okay. So then what about the RN? RN, they do educate the patient. They do patient education, but it has to be initial patient education. They do assessment, initial assessment. So why I say initial education, initial assessment? Because VN, they also do education. VN, they also do assessment, but it has to be reinforced, like reinforced education. It has to be done initially by RN. Example, patient diagnosed with diabetes type 1, they will give you scenario like 20 years old patient diagnosed with type 1 diabetes, who will give initial teaching about injection of insulin, how to inject insulin. Who will give the initial teaching? Exactly. Good job, guys. RN. Who will reinforce this teaching? VN. Very good. Okay. So any initial education, RN. Reinforce education, VN. Okay. Then patient admitted. Patient recently admitted. Who will do the initial assessment right after admission? Initial assessment right after admission is Joanna Black. Yes, it is RN. RN, Cindy, not VN. So initial assessment after admission, it is RN. To follow up on the assessment finding, who will follow up on the assessment finding? The VN. Yes, so follow up on assessment finding is the VN. What else RN do? Discharge education, admission, discharge, clinical judgment, and they can initiate blood transfusion. Okay, initiate blood transfusion. Who will monitor the patient during blood transfusion? After the RN initiate blood transfusion, who will monitor the patient? Yes. So VN will monitor the patient during blood transfusion. Can VN stop blood transfusion if the patient started to have reaction? Why no? Michaela said no. Let me see. What about Joanna and Marissa? Yes. Zach, yes. It is yes, because you see reaction, like reaction for blood transfusion. You need to stop the transfusion because this is safety. You need to stop and report. Yes, but RN, yes, you meant RN has to initiate. Yes, RN has to initiate, start blood transfusion. And the VN, they can monitor the patient during blood transfusion. VN can stop blood transfusion if there is reaction to the blood transfusion. And yes, Michaela, RN has to initiate that. Okay, so what about IV? IV. Can VN start IV line? Yes or no? Okay. Listen, guys. VN can start IV. Don't shoot me here. Don't shoot me. Let me explain. Let me explain. You all know that in California, you need IV certification class, right? This is in California and a few other states. So it is only in California and a few other states they need the IV certification. But HISI and NCLEX is not in California only. HISI NCLEX, it is all over the nation, right? All over the nation, VN can start IV line. Oh, yes, without certification. This only for the state of California, right? So it's not a state exam. It's a national exam. So you guys, for HISI, for NCLEX, yes, VN can start IV line. You can also prime IV line with saline. You start on saline. But do VN push medication, IV medication? This is the big no, 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 right? So the big no for the push medication. You never push medication. Even after IV certificate, you don't push medication. Yeah? But, so don't mix between, you need an IV certificate for HISI and for NCLEX, VN scope of practice. They can start the IV line and they can start saline, prime the line with saline. Okay, deal? Everyone heard of that? Okay. So VN, the guys monitor the RN finding, they reinforce education after RN, they do routine procedure like catheterization, like urine cas, most medication administration, like they can do eye medication, ear medication, intranasal, muscular injection, IM, they do intradermal, subcutaneous, patches, medication, enemas. They do ostomy care, like after colostomy, after gastrostomy, any ostomy care. They check NG tube feeding for VN. Okay, so this is the VN. So this is a RN, VN, UAP. Okay, let's practice some questions. Questions say the nurse is planning the client assignment for the day, which is most appropriate assignment for the unlicensed like UAP. What do you think? Yes. Zach, B, Cindy, B, Joanna, B. Yes, it is B because it is client need frequent ambulation. What about if the client in this question It says after cardiac catheterization. After cardiac catheterization, who will do the ambulation? RN. Good job. Because this is unstable patient. Unstable patient, this is RN. Even ambulation, yes, as long as unstable. Okay. Vital signs for agitated patients. Who will do vital signs for agitated patient? Is agitated stable? Is somebody agitated is unstable? It's not stable, unstable. So good job, Jack. This is Zach. This is RN because this is agitated means unstable. Very good. Who will do wound irrigation? A, it says wound irrigation. Who will do that? VN. Very good. Who will do receive continuous tube feeding? Who will do the continuous tube feeding? VN. Very good. Who will do require frequent vital after cardiac cath? This is the RN, as you said earlier. Good job, guys. Okay, let's look at the. Here I have many patients. I'm going to send you all these, but we have patients here. Let's put the assignment for every patient. Assignment for every patient. Like patient 1, patient with a chest pain and need assistance with ambulation. Should I mark on the RN, VN, UAP? May I ask you to say your answer? Like okay. So Esmeralda, you just joined. Good job. Here you made it. But here, if the patient has a chest pain and need assistance with ambulation, we just said any unstable patient, it cannot be assigned to anybody but the RN. So even if it is ambulation, which we know it is UAP, you're right, it is UAP, but it is a chest pain. So this is unstable. It means we will do it for RN. Okay? Admit patient. Who will admit patient? Yes, RN. Very good. Measure and record input and output. Measure input and output. Okay, what about you guys? Give me your voice because I got the squint now. I keep looking at the chat and then look at the question. So I cannot just exactly match what you put me on the chat. What about you talk? What about we talk? I want to hear anybody talk, okay? Okay, so let's do measure and record input output. This is UAP. Good job. Then wound care. Who will do wound care?
LVN.
LVN, thank you. Then dressing venous ulcer. Dressing venous ulcer. I'm not putting at the, I'm not looking at the chat anymore. So dressing
Would
venous
it be
ulcer.
LVN?
It is LVN. Wound ulcer. Any wound, it is LVN. Good job. Enema administration. Enema.
LVN.
If it is soap, yes. LVN, if it is soap suds enema. If it is soap suds enema, which enema need to be prepared, prepare the enema, this is LVN. But if the question say it is a already pre-packed enema, just need to be squeezed in the patient anal opening, this will be UAP. Okay? Okay, combative patient. Who will deal with a combative patient? Security, right? We need a nurse though. We need a nurse. Nurse. Combative.
RN.
It is which one? Combative?
RN.
LVN.
RN. Because combative is again unstable. Any unstable is RN. Okay, reinforce teaching about insulin, self-injection. Reinforce.
LVN.
LVN.
LVN, very good. If it says reinforce, it is LVN. If the question say initial teaching, this is RN, okay? IV insulin administration,
RN.
RN.
RN. Subcutaneous insulin injection,
LVN.
LVN. Patient with flail chest,
A patient with a
RN.
flail chest, RN. Flail chest, you don't know what is flail chest maybe, but it sounds something emergency or dangerous, right? Flail chest, actually, guys, when there is a big wound in the chest and the part of the chest is like flapping on the top of the other, and like big wound in the chest. So this is RN. Peripheral IV push,
RN.
RN. Empty colostomy bag,
VN.
UAP.
UAP.
Oh.
UAP, empty colostomy bag.
Mhm.
Collect stool specimen,
UAP.
UAP. Suction tracheostomy,
RN.
RN.
LVN, they don't do suction tracheostomy.
No.
In California, no.
Well, in other states they do, but not here.
So what we said earlier, it is not a state exam. It is not a state exam. It is not California exam. It's a national exam. So you can do suction tracheostomy.
Okay.
Yes? Let's
Yes.
make it clear. Gather equipments.
Garden Furnish.
Gather equipments.
UAP.
UAP gather equipment. Good job, guys. Okay. Patient with 2 days after replacement, knee replacement surgery and need assistance with ambulation.
2 days. UAP.
UAP. Insert a straight cath.
AVN.
VN. Collect a clean catch urine sample.
VN.
Clean catch urine sample. Collection of samples. Who do the collection?
UAP.
UAP. UAP, they do collection of samples. If there is a spoiled gauze in the dressing, who will monitor that?
VN.
Monitor or report? Who report spoiled gauze in dressing? Report spoiled gauze.
UAP.
UAP.
UAP can do that. UAP. Dressing venous ulcer.
RBN.
LVN. Wound dressing. LVN. Soap suds enema administration.
VN.
VN.
LVN.
Good job. Ambulate hallucinating agitated patient to CT department.
Wow. RN.
RN, because it is unstable. Routine endotracheal suction.
VN.
VN. Check blood glucose level with AccuCheck.
Oh, this tricky one. VN or UAP?
UAP.
UAP. UAP, because this is something the patient can do to themselves. Yes?
Oh, yes. Today.
So even though it is invasive, but they can do AccuCheck. They can do AccuCheck. Condom caster. Insert a condom, Cass.
UAP?
UAP. Very good. Okay. Then also there is in the exam, upcoming exam, there will be some leadership types. So I have the leadership styles here for you. There are many styles. Read it. It is like self-explanatory. Just to understand, the autocratic one is it is only in emergency. Like if there is emergency, you can take the lead. The leader will assign role to everyone. This is called autocratic leadership. Ethics, guys, could be part of your exam also. So there are 7 ethics rules: autonomy, beneficence, fidelity, accountability, justice, non-maleficence, veracity. So beneficence and maleficence. Okay. Autonomy, number 1. So they are 7 rules. First one, autonomy. Autonomy means what? All by myself. Autonomy, A for autonomy, so it is all by myself. That means the patient has a right to make their own healthcare decisions. Like if the patient refuses a procedure or if the patient refuses to take medication, they have all the right, all the choices to their care, right? So when you give the patient a medication, the patient refuses the medication. What will be your first response? You can chat. What will be your first response now? You can chat now. If the patient refuses a medication, your first response is ask the reason. Very good, Marissa. You want to know why the patient refused the medication. Maybe this medication caused him like to get some side effects, like make him drowsy, or the patient feel nausea. So number 1, ask about the medication, the reason, and then if they don't want to take the medication, you don't give the medication and report that in your chart. Then beneficence. Beneficence is the duty to do the good. Beneficence, you do the good thing for the patient. What is good here? Like if you put heat compression or cold compression for 20 minutes only, not more than 20 minutes. This is good thing because you do the right thing for the patient to prevent them from getting any harm. So beneficence is don't harm your patient and do the good, do the right thing for your patient and act with compassion. Like example, holding patient hand in hospice care. You do something good. You're acting with compassion. This is beneficence. Another example, the patient has a right to know that they have cancer. If this is a family wishes, don't tell the patient that he has cancer. Can we hide this from the patient? If the patient asks you, you don't lie. You cannot lie to the patient. Okay. Then, third rule, fidelity. Fidelity, F. Remember, fidelity with F, being faithful. F for fidelity, F for faithful. Be faithful, loyal to your patient, loyal in your action, loyal in your care, to your profession and to your patient. What is the example? I want to be very faithful to my patient. Even if my patient is Alzheimer and the patient is asking, they want to take a bath, like bath. So you will tell the patient, I have 15 minutes to give other patients medication and I will be back. The nurse coming back after 15 minutes. Even the patient is Alzheimer and forgot about the request, the nurse has to be back because she promised. She needs to be faithful and loyal. If the nurse stand with the patient in post-mortem care before the patient asked the nurse to stay with her during post-mortem care, the patient may be not feeling anything. They are dead, but she is faithful. She is loyal to her patient. So being faithful and loyal, like you do your promise. Then accountability, for sure, you're responsible for your action, even though whatever will be the consequences. Tell me, number one, example, if you give the patient wrong medication, number one, what you will do? Report or something else? You give the patient wrong medication. Number one, what you will do? Send me on the chat.
Try to fix it.
Check the patient. Very good. Number one, you check on the patient. Patient before the paper. Patient before documentation. So check on your patient before you document and then do the incident report. Very good job, guys. Then justice. Remember J for justice. Just want fair care for all patients, regardless background, regardless to their social, gender, and ethnic group. So just fair act to everyone, equal care to every patient. Non-maleficence is when you don't do the bad thing. Like example, don't leave the heat pads on the patient. If they have pain, you have heat pads on them. Don't put the heat pads right on the skin, because if you put the heat pads right on the skin, this is bad. This is harmful. So this is the non-maleficence. You need to put the tissue between the heat pad and the skin. So don't do the harm. Don't do the bad thing. This is non-maleficence. Veracity is very honest. Be very honest. You give the patient certain medication and this medication causes itching. You tell the patient, maybe the medication we just gave you, it caused you the itching, right? So be very honest. Tell them the truth. Okay, let's have an example. You self-read the question and send me your answer. Which of the following is a correct understanding of nursing ethical principle? Which one is correct? You may chat.
C. Number 3.
Put on the chat. Okay, everyone agree on you, Raiden. Good job. It is number 3. Fidelity is faithful. Stay with the patient during death as promised. You are faithful. You are loyal. Okay, let's do number 1. What is number 1? Why number 1 is not correct? Justice is telling the client the truth that medication can cause rash. Is it justice? What is number 1? It's not justice. What is this? Telling the truth. Be very honest. What is that? Veracity. Good job, Zach. Veracity. What about number 2? Autonomy is requiring the client to have advanced directive. That is the opposite. Autonomy is all by myself. Advanced directive, you have somebody else to take decisions for you, right? So they are opposite to each other. Advanced directive, when you have power of attorney, when you assign somebody to take decisions in case you are sick to the point you cannot make decisions. Beneficence is not telling the client that has cancer as family wishes. Is this correct statement? No, this is incorrect. Beneficence is to do the good thing. Okay. Okay, guys, so these are the rules, the ethics rules, the 7 rules, okay? Then also you need to remember tort. What is tort? There is intentional tort, like assault, battery, false imprisonment, and there is unintentional tort, like negligence and malpractice. So let's see that. What is assault? Assault is when there is abuse. Abuse means could be physical or verbal. You can abuse somebody emotionally, just saying something hurt their feeling. So abuse, assault is physical or verbal abuse. Mostly physical in our condition, like as example, if you put the patient on restraint without a doctor's order. Oh, can we do that? Yeah. So restraint order, how long it is valid? If you have a restraint order, how long it is valid order from the doctor?
24 hours.
24 hours, just 1 day. 1 day after, like a minute later, this is called assault. Okay. Battery is unlawful touching. If you touch someone with no permission, can I check your vitals? May I check your pulse? You need to ask. False imprisonment, like if you do excessive straining or if you even threat your patient that you will strain, this is called this is assault, sorry. So false imprisonment is excessive straining, or if the patient want to leave the facility and you prevent them from leaving facility. If they want to leave the facility, put them in AMA, like against medical advice, and they can discharge the patient. Then negligence, when you forget to do your duty. Like example, you left cold compression or heat compression more than 20 minutes, or you forget to change dressing and infection happened. So anything you didn't do correctly, this is called negligence. Negligence in our profession also called malpractice. Malpractice is professional negligence occur when we as healthcare team don't do what we supposed to do, and that cause patient harm. Okay, and then there is breach of confidentiality and there is defamation of characters. What is breach of confidentiality? Like when you share patient information. If you share patient information, this is breach of confidentiality. You don't have to say it. Even if you leave the patient report on the copier, on the copy machine, talking about the patient during your break, talking in the elevator, you cannot talk about your patient. This is breach of confidentiality. Then there are 2 other terms, slander and libel. Slander and libel is both called the defamation of characters, but slander when you speak about somebody badly. Slander, speak badly. But when you print material to defamate a character, this is libel. Okay? Remember the Nurse Practice Act, guys. What the Nurse Practice Act provide us with your scope of practice. The nurse need to understand the scope of practice, go to the Nurse Practice Act. Disciplinary actions, it is Practice Act. The rights of the nurse licensee, if disciplinary action is taken, it is also Nurse Practice Act. Licensure requirement, you will find it in the Nurse Practice Act. So all these will be in the Nurse Practice Act. Okay. Okay, this is informed consent also. The thing is, I don't want to go deep in ethics and law because most of your exam will be, as I said, it will be delegation, it will be prioritization, some ethics, yes, here and there, but mainly delegation, safety, prioritization. This is mainly in the exam. Let me give you a few points here to remember, and you may write it down. One second, give me 1 second. Let me retrieve the document I just had here. Okay, now let me give you some Q and A. Okay, do you hear me, guys? Okay, patient has AV fistula for hemodialysis. What is your priority assessment? Patient has AV fistula for hemodialysis. What is your priority assessment? Yes, I'm waiting. Assess for Bruit and Thrill. Very good. Very good. Mikhail, Zelda, Zach. Good job. Thrill and Bruit. Wonderful. What action show what is multidisciplinary healthcare team? What multidisciplinary healthcare team means? What is that? Multidisciplinary. Yes, we have Q and I need the answers. Q and A time. What multidisciplinary care team provide? Yes, other team like PT, physical therapy, occupational therapy, different care plan like social worker. Yes. So number one word here, we need to have good coordination. We need to coordinate well when we have I misspelled it. Coordination with many specialty. This is called multidisciplinary team. Okay. Sentinel event. Sentinel event. If a sentinel event happen on a unit, what is the nurse priority action? Number one, sentinel event. Any sentinel event. Document is number one. Did we say documentation is number one? What is our number one? For sure you will document, Michaela. but not number one. I will check on my patient. Good job, Zach. I will check on my patient. Yes, Esmeralda, check on the patient after sentinel event. Ensure patient safety first, then report the event according to the facility policy. Routine hygiene care. The VN delegate routine hygiene care to who will do? Yes, UAP. Very good. Who will do supervision and evaluation of the task? For UAP. For UAP, LVN, they supervise and evaluate the task. Very good. If there is G-tube feeding, who can perform G-tube feeding? We all know it is LVN, right? But listen, guys, Hissy kind of tricky tomorrow. Listen, Hissy kind of tricky tomorrow. G-tube feeding could be delegated to trained UAP, depend on the facility policy. Yes, NCLEX and Hissy, they allow trained UAP to give G-tube feeding. Hope everyone heard me. Yeah? It is different, yes, but let's take it. It's a if it is trained UAP and the facility policy allow that, yes, they can do G-tube feeding. And they will give you many examples like UAP doing hand hygiene. Which of the following steps the VN needs to reinforce? What the reinforce here means? Which of the following steps of hand hygiene the VN need to reinforce? What reinforce here means? Reinforce. Okay, you want to show. Reinforce, you want to show them. It means they did something. 1 second. Yes, very good. So I just confirm it. So you reinforce means you want to reteach or re-show, re-explain to your client. Good job. Okay. Self-management. What is your understanding of the word self-management? Teaching patient self-management. What that will promote? What the self-management when the nurse teach self-management? What that? Good job, Esmeralda. Independence. Very good. Independence. Good job, Michaela. So promote independence and safety for sure. Yes? If your patient show depression or grief, what you should do? Depression. What you should do. If your patient show depression or grief, what you should do? Safety concern first, absolutely, yes. Make sure the patient is safe, yes, and report it to your supervisor. Report it to your supervisor. Make sure there is safety. If you notice there is depression or grief, you need to report it. Okay. Also, safety of medication administration is important for your exam tomorrow. Like if you're giving medication and you withdraw medication from an ampoule, how you withdraw a medication from an ampoule? Filter needle. Very good. Filter needle. Why, guys, we want to use filter needle to withdraw medication? Because there are glass coming maybe from breaking the ampoule, some glass shattered. You want to do the filter needle to avoid having glass in the ampoule, in the injection. Very good. What is evidence-based practice? Evidence-based practice. There is something called evidence-based practice. What is that? FDA? What do you mean by FDA? FDA approved? Okay. Objective item like labs, X-ray. Yes, exactly. So evidence-based practice, listen guys, evidence-based practice combines three things together. Evidence-based practice, number one, research evidence. Okay. I know everyone is tired today. I'll do my best, guys, to make it short. We will finish early. So evidence-based practice is number one, you want to do best research evidence. Like you get information from studies, from clinical guidelines or scientific researches. And the nurse knowledge, you need clinical expertise. Nurse knowledge will put her or his training, her or his expertise. So number one, best research studies. Then you put your clinical expertise, and then what the patient want. Patient preferred. You need to use patient preference and values to apply evidence-based practice. So three items to apply evidence-based practice. Number one, use information from studies and the clinical guidelines. Number two, use nurses' knowledge, nurses' training and experience. Number three, you do what the patient wants, or according to the patient beliefs, and make the patient comfortable. So evidence-based practice, three combined things. Research based, so get information from research. Number two, nurse experience and training. Number three, patient reference. The three together, you apply evidence-based practice. This is a meaning of evidence-based practice. Patient in box traction. You have patient in box traction. Type of traction, okay? What is your priority action? If you have patient in box traction, what is your priority action? I will take your chat. Box traction, what is your priority? Skin integrity. Yes, very good. So safety. You want to make sure safety. You want to make sure also the weights they hang freely, because there are weights. You want to make sure that they hang freely, right? UAP can check that the weights hang it freely. The UAP can check that weights are hang it freely. Okay, fire safety. Fire occurs in the unit. What is your correct first action? First action. Fire. Number one. Number one. First action after fire. So give me number one. It is the race. What is the R? Rescue. Good job. Rescue your client. Who I'm gonna rescue first? I'll give you 3 clients. Okay. First client is like patient waiting for physical exam, routine physical exam. Number 2, patient on a wheelchair. Number 3, patient on crutches. Patient use wheelchair. Patient use wheelchair.
1, 3, 2.
Patient use crutches. Or patient that just they can walk and they are here for physical exam. So who will be rescued first? Number 1, 1, 3. Which patient? Number 1, patient on crutches. I will do the patient who is walkie-talkie first. The patient who can walk by themselves, I will let them go first. Then I will do crutches. Then the wheelchair. What is the reason? To be fast. To be fast, you need to rescue who is fast first. The one who can walk, yeah, you first. And then crutches next. And then the patient on wheelchair. It will take you time to put the patient on the wheelchair, right? That's a time consuming. So that will be the last. This is for everyone fair action, because if you take that long time with the patient, you transfer to wheelchair, that might take from the time of other people who are walkie-talkie, right? Okay. Vital signs on stable patient. Routine vital signs on stable patient. Who will do that? UAP. Vital signs after cardiac cath. RN. Very good. So if the patient not stable is RN. Even vital signs. Yes. Then they will give you questions, guys, like what patient you want to see first. They give you a bunch of patients and they ask you what patient you want to see first. You may use different priority methods. We learned together prioritization. We talked about the prioritization before. Did we? Did we do the prioritization together many times? Yes or no? We talked about this in class. We talked about this maybe also during the meetings. So let's talk about the prioritization a little bit, because you will get questions like what patient you need to see first. So let's see what patient I want to see first. I will give you very quick tips. I will see the unstable patient before the stable. So let's put here spectrum of stability. Spectrum. Let me show you something better than me writing. Let me show you actual chart talking about spectrum of stability. Part of our exam tomorrow is prioritization. What patient you need to see first. So let me share the screen quickly here and give you some tips on how to choose the patient you want to see first. Okay. This is a spectrum of stability, which will help you to judge what patient you want to see first. First of all, you want to see the patient who will see last. Don't think of seeing somebody going for discharge first. Don't be the nice person who will be like, oh, they want to go home. It will be fast. No. Patient discharge, he's good. He can wait until the end. So don't pick the discharge patient. Don't pick the patient going to be assigned to new grad or floating nurse, because this is a stable ones. Then who I will see first? I will see first the patient with acute finding, like sudden, the word sudden chest pain, sudden abdominal pain. Something happens suddenly. Patient have cast, the patient has cast and start to have sudden pain. Or new finding, like somebody was in cast and they are doing well, and now there is a change in condition. They started to have numbness, right? So any acute finding or changing condition, this is my first patient. Also, I will see patient with unexpected finding, like somebody admitted for hernia repair and started to have wheezing in their chest, like they are just here for hernia repair. Why they have wheeze? This is unexpected. So I will see the person who has unexpected finding first. Yes, do you agree? Unexpected finding. Okay. What about post-op? When post-op will be the first patient I want to see? What is the time frame for post-op? It will make him first one to see. 24 hours, 48 hours, 72 hours. What post-op, what is the time frame make post-op my first one? This is my first one I want to check on. What is the time frame for post-op to make them acute patient? Raiden said acute versus chronic. Very good. What make post-op acute? Yes, good job, Zach. Zach said 24 hours. 24 hours. Good job. First 24 hours. For post-op, this is my acute patient. Because in the first 24 hours, many things could happen. Could be bleeding issues. Could be anesthesia issues. Many unexpected things could happen in the first 24 hours. So post-op, first 24 hours. For sure, Raiden said acute patient versus chronic, like acute finding. Okay. Chronic patient, I will see them right before the stable ones. Like patient with COPD, they are chronic. But if patient COPD started to have grunting, will I also keep him like right before the very stable patient? Or will I change him to be number one patient to see? Grunting is a changing condition. So grunting means a changing condition. So if the question says COPD grunting, Grunting means a change in condition. He's not chronic, stable chronic anymore. He is a change in condition, so I'm going to see him first, right? Okay. Patient with ulcerative colitis. What is ulcerative colitis, guys? You expect the patient have like many attacks of bloody diarrhea, right? So if the question say patient with ulcerative colitis has 3 bowel movement, 3 bloody bowel movement, will I see him? Will I count him number 1 or number 2 or number 3 or number 4? Ulcerative colitis with 3 bloody bowel movement. What number? I will categorize them where? Is it expected for ulcerative colitis to have 3 bloody bowel movement? Yes or no? It is expected. Yes. So fine. He's my chronic patient. He's more stable. This is something expected. But if the question say ulcerative colitis and he's hemorrhaging per rectum, what number now? 1, 2, 3, 4. 1. Good job, Zach, because now he's a changing condition. So pay attention to the scenarios they give you. Is it acute? Is it chronic? Is it expected finding or unexpected? Is it a changing condition in a stable patient? And then you categorize the bunch of patients based on the spectrum of stability. After the very acute ones, unstable, I will see the newly admitted or recently admitted. You guys, I believe I gave you a copy of this sheet before. Do you have access to this sheet? Yes or no? I consider this as a yes. So, because you did not request, so I believe you have access to this. So this is a spectrum of stability. Also, don't forget, you can take a picture. You can take a picture. So let me clean it up so you can take a picture of this. Now it is clean, you can take a picture. So we can use the spectrum of stability to recognize what patient I will see first. What else we can use? Don't forget the Maslow, the airway, breathing, circulation. I will check the airway before breathing, then the last is the circulation. So also this, it goes in order. So you will get questions on what patient I will see first, or what is your priority intervention. Okay. Also, you will get questions on safety when you administer NG or G-tube feeding. You need to know the rules of G-tube feeding. You want to know that you want to flush the tube before and after medication, right? Should we flush the tube before and after medication? Yes. Flush first 30 ml, and at the end you do also 30 ml. If you give more than one medication, you also flush between each 2 medication. How many ml you flush between each medication? How many ml you flush between
5
each
to
medication?
10.
5 ml. Very good. 5 ml between each medication. Make sure don't crush the sustained release tablets. Don't crush the enteric coated tablets. PICC line. PICC line. Can we delegate PICC line to UAP? No, because it is a sterile. Very good. It's a sterile. PICC line. Okay, give me 1 second. What is your first action?
Reassessment, the vital sign.
Reassess. Very good. Reassess. Don't go report it to the supervisor. Reassess vital sign. Very good. Okay. If you have elderly patient shouting at the staff, what is your best response? Elderly patient shouting at the staff. Make sure you take notes on these questions, guys. This is from previous HISIs.
Distraction.
You wanna know the reason. Maybe there is certain reason, right? So if somebody shouting at the staff, you wanna remain calm and assess the reason. Why he's shouting? Assess. First action, you need to check your priority action. Priority action, you do your nursing, the ADPI. First, you assess what make him shouting.